IPOCs are embedded into clinician workflow, thus providing a standardized method for clinical documentation and supporting the ability of teams to function collaboratively, effectively, and efficiently. All clinicians caring for the patient review, update, and evaluate the patient's progress towards meeting goals. The IPOC section on Care Compass resides in the far right column. When looking at Test Patient, Build, NKC, IPOC, I see 6 suggested plans of care. Hovering over this area shows me the name of the 6 suggested plans of care for this patient. Right-click. Select Orders to open the Orders tab, which is where the IPOCs live in PowerChart. In the window view, I see Suggested Plans. Click the plus sign to the left of Suggested Plans to open all of the suggested IPOCs. Hovering over the suggested IPOC shows the date it was suggested as well as the reason the IPOC was suggested. This information is also displayed in the blue section at the top of the IPOC view screen. Decrease the size of the view panel or hide it by clicking the black chevron at the top right of the screen. This will allow you to see more real estate of the IPOC. For IPOCs that are suggested based on the patient's reason for admission, clinician documentation, or lab results, the clinician has 2 choices, either to accept or reject the suggested IPOC. If the suggested IPOC problem is unique and relevant to the patient and is keeping the patient from moving to the next level of care, click Accept. Otherwise, click Reject. Reject should be carefully used by the clinician and selected only if the IPOC problem is not keeping the patient from moving to the next level of care. Rejected IPOCs will not resuggest for 5 days from the date of initial suggestion. However, clinicians are able to add IPOCs from the Orders tab as necessitated by changes in the patient's condition. After accepting an IPOC, it will change to an initiated pending status. It moves from the Suggested Plan area to the Interdisciplinary area in the View panel. IPOCs consist of 2 sections and include 3 components. The 2 sections are Outcomes and Interventions, and the 3 components include goals that when met enable the patient to move on to the next level of care, indicators which appear as a graph icon that document the patient progress towards the selected goals, and interventions that are independent clinician actions not requiring a physician order. Certain IPOC will also contain notes to the clinician and evidence links to Zinc's content or North Kansas City Hospital policy. After an IPOC has been accepted, results related to that IPOC may appear for your review as you are individualizing the plan of care. If the Related Results band displays a number in parentheses, click to open the Related Results band. You may double-click on a specific result to see more details. Notice that some IPOC components are pre-selected and some checkmarks are dithered or grayed out. If only one goal is listed, that IPOC component is required and therefore unable to be unchecked. Pre-selected components that aren't required can be unchecked if they are not unique and relevant to the patient and won't assist in helping the patient move on to the next level of care. It's now time to individualize the IPOC. Select IPOC components that are unique and relevant to your patient and those components that will help the patient move to the next level of care. Goals and interventions can be modified prior to initiation. A patient-specific goal and a patient-specific intervention are included for added individualization. To modify an intervention, it first must be selected by placing a check mark in the box to the far left. Then you are able to right-click and select Modify. Double-click in the description field in the Details section at the bottom of the screen to remove the default text and replace it with your own text. When finished, click Enter to save the individualized text. When the Details section is collapsed, the new component becomes part of the IPOC. It is important to note that indicators cannot be modified. This is because they are pre-selected components that gather documentation being charted by clinicians throughout each shift. Indicators, remember, document the patient's progress towards meeting the selected goals. If a component is not listed that you think should be added to the patient's plan of care, click Add to Phase. And select Add Outcome Intervention from the drop-down menu to search the entire list of components used in all IPOCs. Type a keyword in the search field. Click Search. Then click to highlight the desired component and click OK to select. After individualizing the IPOC, click Sign. After clicking the Refresh button, the IPOC status changes to Initiated. The status column is currently empty, but will display results relevant to each outcome and intervention as details are charted in iView, PowerForms, and the other parts of the patient's EMR, or details can be charted within the IPOC too. To add components to an IPOC after it's been initiated, click the View Excluded Components light bulb icon to bring excluded components back in view with a checkbox. Included components are listed but without a checkbox. After clicking the checkbox, a light bulb appears. Click Sign to include the added component into the previously initiated IPOC. Click the light bulb icon again after refreshing to remove the excluded components from view. There are two procedural IPOCs, one for joint repair replacement and one for cardiac surgery, including CABGs and valve repairs, but not pacemaker placement. For each of these IPOCs, there are multiple problems which initially appear in a planned pending status. These two IPOCs will not be suggested, rather they will be added by PSC, pre-op, or outpatient procedure with recovery for these patient populations. To add any IPOC, click Add and search for IPOC. I will select the Joint Repair Procedural IPOC. All of the patient problems in the IPOC can be initiated at one time by clicking on the IPOC name and clicking Sign. Or, probably more appropriately, the individual patient problems within the IPOC can be initiated separately in order to individualize the care of the patient. The patient problems that are initiated will be displayed in bold with the status Initiated. And the remaining uninitiated patient problems will display in normal font with the status Planned Pending. The patient problems that are initiated will be displayed in bold and the remaining uninitiated patient problems will display in normal font. The steps for individualizing and initiating are the same as those previously described. To discontinue an individual component after it's been met or when it's no longer appropriate, such as after the FAQ handout has been provided, click on the component, select Discontinue. Then click Sign. To discontinue an entire IPOC after it's been met or when it's no longer appropriate, such as after the patient's been discharged and all goals have been evaluated, right-click on the IPOC in the View panel and select Discontinue. When the Discontinue window opens, select the discontinue reason from the drop-down list. Click OK and sign. To void an individual component or an entire IPOC when entered in error, right-click on either the component or the IPOC name and left-click on Void and Sign. After IPOC initiation, each clinician's workflow should include reviewing the patient IPOCs before seeing the patient. IPOCs to review include those initiated, including the goals, indicators, and interventions selected, any remaining in a planned pending status for the joint repair replacement and cardiac surgery IPOCs, and any suggested but not yet accepted or rejected IPOCs. At least once a shift and at transfer and discharge, the clinician will document the patient's status and progress in the IPOC. First, review the related results for the IPOCs selected. Then click the Document in Plan tab. A list of results documented by clinicians caring for the patient appears. A green check mark indicates the result meets outcome criteria, whereas a red X indicates the result did not meet outcome criteria. Clicking on a specific result will highlight it, and the clinician will be able to see more information in the outcome description field, such as who performed the documentation. If you see an indicator or intervention that you performed but didn't document earlier, click on the Quick Chart checkmark in the status column in order to quickly document a result. When charting a negative result, such as not met, not done, needs further teaching, or needs practice supervision, document the reason and action taken in the Outcome Variance section. You can either select from the drop-down list provided or free text. To document an evaluation of the patient's progress towards the selected goals, click on a goal to open the Outcome Description field at right. Chart met or not met. And if you document not met, remember to document the reason and action taken. And then sign your documentation. Thank you for completing this Power Up Learning module. You may close the window at this time.